So let's start our actual presentation. I'm going to bring up my slides here. Yeah, I'm not sure how many people are medical here. Consequently, I thought I should walk you briefly as to really what virus is. There are three microbes that are causing us headache: the bacteria, the fungus, and the virus. Okay, these are there are three distinct organisms. The organism causing us headache and illnesses, etc., infections, really they fall in these three major groups. I thought here I should let you see a little bit the human cells, okay? The human cells have the chromosome has the DNA and the genes, okay? So as you can see, the smallest unit of the living cell, the living being is the cell. That's the small, just if you were to imagine a building, that is the brick. That is the brick that is built up to form a building. This is the building block of humanity. And we are formed out of trillions and trillions. Some estimate like 31 trillion cells form as the human being. And some organisms like bacteria, they're just a single cell, okay? And most of the viruses, they are DNA living things. They are not even a cell. They are a portion of the cell, very tiny little things, okay? And this is a bacteria. Bacteria is just a single cell. And inside it has the genetic material. The rest of the thing is to support its living structure, but just it's a single cell. While we are trillions and trillions of cells. In fact, our DNA material, if you were to stretch it out of the cell, it will amount to about 2 meters. That's taller than me. I'm 6'4", okay? And this is just a single DNA in a cell. So if you take all the DNAs, you put it head to head, it will go around the solar system twice. That is mind-boggling. That the scripture says wonderfully and fearfully made. Now think about this. This is structure that is about 2 meters. God has packed it in a diameter that is invisible. Imagine you are trying to put a 2-meter thing in this diameter here. You're going to struggle, but the wonderful Lord has no trouble with that. When you think of the structure that is you, which goes around the solar system twice, that put chills in my body. Anyway, that's just a science trivia. And this is fungal. They're all tiny stuff, actually invisible. This now is virus. The virus is actually just a piece of the genetic thing. This thing here, that's just one of those or two. In terms of COVID, the COVID is an RNA virus. It's just one of those tiny strands. There are important clues we're going to get out of these pictures. The virus genetic material is this thing that looks like a spaghetti. And then the spikes, this is why it is called corona in Spanish, crown. This is what makes it look like crown. Now, the coronaviruses, 25% of the cold we get during the winter come from the coronaviruses. Until 2002, humanity has come in contact with 4 species of coronavirus. They are benign, they cause the common cold. Once you get it, you have about 12 months immunity, and then you get it again next year. And then 2002, SARS-CoV-1 came. It was the first malignant, deadly coronavirus humanity came in contact with. Where did it come from? It came from bats. The bats have thousands of different types of coronaviruses, but they have no ability to infect us, okay? Why does viruses need a host cell? It is because the viruses have no ability to produce. The viruses cannot make more children for next generation. They need to get there is a copy machine called RNA polymerase. It's a copy machine. It sees this genetic strand, it starts to make copies. Guess what? At the other end, you are getting new viruses. So the coronaviruses, COVID SARS, they do not have ability to get into the cells. SARS-CoV-1 won the lottery. It discovered the ability, this is their key. This is what they call the spike protein. This is what goes in and open the door for them to get into that cell. So that was the first. It came from bats. And then MERS, which is the Middle Eastern one, that was the second deadly one in 2012 in the Middle East. It also went from bats to pangolin, from pangolin to camels. And then SARS-2 or COVID-19, it went from bats to pangolin and pangolin to us human. Think about this. I want a little bit of trivia here. The black plagues of the vertebrates went from, it's a bacteria called Yersinia, went from bats to rats. And then Hispanic flu of 1918 is the actual American flu because it started in Kansas. It went from pig to human. HIV/AIDS, we think it went from chimpanzee to human. Ebola comes from bats to human. I just say CoV-1, it came from bats. MERS came from bats. SARS-CoV-2 came from bats. What is the common theme? These are unclean animals. No plague, pandemic has ever come from clean animals. Does the Almighty knows what he's doing when he says, thou shalt not eat this thing? Actually, he even said, don't touch it. Anyway, because we came in contact, I think one of the things that has to come out of this pandemic is some creatures, we have to leave them alone. Because we interact with the bats, this SARS-CoV, the viruses constantly mutate. That is their ability, that's how they defend themselves. They cannot move, they cannot fly, they cannot do anything. They only evade the immune system by constantly mutating. They mutate everything they can. In the process of mutating this, changing this, they discover it was a perfect thing to open the door to get into ourselves. It won the lottery, thanks to us eating unclean animals. So it won the lottery. And so there we got infected. So another very important thing here, if you look here, this is called the lipid bilayer. This circular thing here, that is a fat layer. Important scientific concept we derive from this. If you put oil with what happens? The oil breaks up. That is the reason why hand washing with soap is such critical, because it breaks this layer up. If you break this up, the genetic material inside has no way of defending itself. That is why hand washing is such critical, such important. Hand sanitation. This is the most important concept we can derive from here. When you wash your hand with soap, the soap break up the fat layers. If you break this, guess what? The spikes all fall off, and this virus has no way defending itself. Okay? Please remember that. That's the most important thing for that slide. So, who are the high risk for this? When we say high risk, if you get infected, who are the people likely to do poorly? Who may end up requiring hospital admission? Who may actually end up dying? Men older than 50, female older than 60, diabetic, huge risk, high blood pressure, lung disease, heart disease, kidney disease, etc. Severe obesity, and here I must highlight this, vitamin D deficiency. when the surge was going on in New York, majority of the victims of COV-2 are African Americans, followed by Hispanic. And from there, some of us started to suspect vitamin D deficiency could be a huge factor. In fact, until this summer, almost everybody I admit requiring ICU management is vitamin D deficient. Almost everybody. No one I put on BiPAP is vitamin D normal. Why is that? Vitamin D is an important regulator of the immune system. In other words, it prevents the immune system from overreacting. Why is it? And then African American and Hispanics, the pigments, my pigment, there is no better sunscreen than this black skin. So when I go out on the sun, the UVB light is blocked. I need to stay on the sun longer than somebody who is not my complexion. So consequently, Black Americans are 84% vitamin D deficient. Hispanics are about 62%. Whites are about 40% to 42%. That may explain the racial disparities in addition to nutritional status. So really, you are eating well, you're eating natural, you're taking supplement has impact in many ways. This may be also the reason why children are not having it serious, because children, as we age, our gut loses the ability to absorb all the nutrients. Children do not have that problem, okay? Even as we age, our skin loses ability to produce vitamin D. It will require longer. Therefore, really, everybody should know their vitamin D level. Everybody should supplement vitamin D. That really is critical. Eating natural, eating holistic, and eating well helps boost your immune system and strengthen your immune system. So if you were to get these things, you handle it better. So this is an important slide in terms of the risk factors. I thought to highlight that. Now, we're going more into clinical. New England Journal of Medicine put this article, and to me, that was an eye-opening when I first see that. So here, this is your incubation period. This is the period when the virus come in, it hijacks the copy machine, and it is cranking up productions, by the way, into trillions of viral cells. While that is happening, your immune system has no clue there is an invasion. By the time they realize there is an invasion, guess what? That is day one when your body stage response. And from day one, when you start to have these symptoms, your body already discovered there is an invasion. And guess what? People start to develop shortness of breath by day 7 of symptoms. We are going to talk very heavily on this. This will be one of the important takeaway points. Day 7, people start to develop shortness of breath. And by day 10, people enter into the critical severe phase. We notice more data. The first day of symptoms, remember, incubation period when the virus enters and it is producing and your body is not aware there is danger until the first day of symptoms, the virus is awash, your body is awash with it. As the day go by, the virus is being cleared out. The immune response is very effective, by the way. It is amazing. This is mind-boggling, by the way. It's amazing. God has designed our body in such a way that in 14 days, your immune system is able to clear this virus off. In other words, your body has developed a vaccine, an antibody, 14 days. In fact, IgM come up by day 7. That is the first time your antibody is already produced by 7 days of symptoms. But see how long it is taking us to find a vaccine. But yet we're very arrogant. So it's amazing how our body is made. But anyways, and then something phenomenal start to happen here by day 7. The immune response, the inflammation builds up tremendously. There is a clinical implication. We will get to that. We also notice this is the viral load I was talking about. You had zero virus here. It is built into trillions in your body. And then by 1 week, it drops significantly. By 2 weeks, it's almost disappeared. It's all dead. Your immune system is able to effectively kill this thing. But something tremendous is happening. I call it inflammatory tsunami. I have a blog on this on drimuro.com. There is a long article there. This inflammation here from day one is start to build up. By day 7, it takes off like an airplane. Remember what I showed there earlier? People are developing shortness of breath at day 7. Is it the virus? I don't think so. It is the inflammation. It is the immune response that is becoming a major issue. So think about it this way. There is an invasion, all the armed services, the Army, my favorite, the Navy, the Air Force, everybody, they assemble and they unleash their payload on the same target. Even after the target is pulverized, they keep on shooting. That is exactly what is happening with COVID-19. Our immune system have never seen this thing before, and they panic. When certain conditions are present, when certain nutrients are not present, they do not know how to regulate to fire appropriately. So they end up firing excessively and continue to fire. It is friendly fire that is killing us. It is friendly fire that is making us sick, because in fact, the newest data is by day 4 of symptoms, 50% of the virus is annihilated. But yet, the immune system take off the wrong direction. Those who do poorly with the virus, this is the phenomena that is happening. This is the data that came out of Mexico. For those who speak Spanish, this was actually very fascinating. This, as I say, this is the incubation period. This is the time when the virus is still producing. For those who are in medical area, the immune system, the immunoglobulin, this is the antibody. This is the vaccine they are trying to produce to elicit, so our body can produce the IgM. From day 1, the IgM actually show up. It show up by day 7. About day 7, day 8 is when the IgM show up. And the IgG, which is the long defense, show up to 2 weeks. This is why we cannot use the antibodies for screening for those who have the COVID, because it takes too long to show up. The PCR, however, it is the same thing you think being used in forensic medicine. It looks for genetic material. It doesn't say whether the virus is dead or not. As long as the genetic material is there, it will tell you. Just like somebody who committed crime and left a dry blood, the PCR will tell whether there is, whose blood is this. This is exactly what the PCR does, the one we are using for testing. So the PCR actually could be positive from day 1 when the virus came into your system, but definitely by day 4 of incubation, you could test positive. This is why sometimes you catch people asymptomatic in the incubation period. And then a few days later, they develop symptoms. By day 4 to day 10, clearly the PCR is going to be positive. And then once a person starts symptom day 1, that is usually after being infected 5 to 6 days. Again, the data out of Mexico also shows people are starting to be admitted in the hospital, okay, from about day 5 all the way here to day 7. And then people are ending up in ICU about from day 8 onwards. People are ending up on life support from day 12. This is going to be critical as we move forward. Now, let me take a little bit of time here. This is an important slide. I hope I haven't lost you. Again, remember, we say the incubation period is when, can you see my slide? I mean, my pointer? Very good. So day 1 is when you came in contact with the virus. Let me say something important here. We don't have the data out yet, but the data coming out of SARS-1 of 2002, when a person who is infected specifically from here all the way to day 3 and 4, remember, your body now have trillions of this virus. This is the maximum load you have. When you cough, that single cough, you are releasing 200 million viral particles. When you sneeze, you're releasing about 200 million viral particles. Guess how many particles the person sitting next to you need to inhale in order to get infected? Only 1,000. Only 1,000. So if you're infected and then you go into that bar, you go into that restaurant, you go into that closed classroom, you go into that building that is closed, and you cough, you cough twice, you release millions of virus, it's enough to infect everybody who is there. That's why this thing is such contagious. So CDC now tell us most of the current surge, it is people getting infected in small groups. Okay, in small groups. People sharing. One of my nurses, they took a 6-hour ride, 3 of them. They are not family members, 3 of them. And guess what? One person there was infected and then the other 2 completely got infected. Okay? We have had outbreak in the hospital, nurses getting infected. Not from patients, because we put out the PPE, we put out the mask, which is extremely effective in preventing this infection. But when they sit in break room, they take off the mask, they're munching and talking and laughing. Guess what? Even if you're not coughing, the talking, you release some quantity. If you're speaking louder, it requires more air, so you're releasing even more. When you're singing, you release even much more. You're laughing, depending on how loud you laugh, you release more. So we had tons of nurses that got infected through that way. So the point here, right here, I must start from here as we're going forward is, when you are loaded with the virus, you're releasing millions of it just from a single cough and a single sneeze. You put everybody around you at risk. So once you are infected here, you go into this, your body is cranking out and you build up this. You are in the viral phase. This is an important language I'm going to use here. The first week is phase 1, you are in viral phase. Your immune system is barely waking up, and then they take stage, and now the inflammation take off. From day 7, you enter into phase 2, you enter into phase 3. Phase 3 is from day 10 onward, okay? Most admissions occur from day 7, 8, 9, and 10, and ICU from day 10 onward. Okay, so the critical thing here is the incubation period and how much really you can release to infect others. That's why it is important to avoid weddings, to avoid birthday parties. Beautiful Zoom birthday party. That was a wonderful idea, Arturo. I loved it. I'm like, more people should do this. For God, let us help each other out. Let's save each other from this. Okay, that little lapse you have, you do not know what will happen. Before I forget, let me say this. I'm from Africa. As a kid, I was growing up, I got infected by malaria thousands of times. The agent that brings malaria is what? Mosquitoes. When I was in Mexico, I treat a lot of patients with dengue. The agent that brings dengue is mosquitoes. So if you do not want dengue, if you do not want malaria, stay away from mosquitoes. What is the agent that brings COVID-19 to you? It is me. It is you. So we humans are the agent. Anyone who is not a member of your household is a mosquito. I thought I should put it that way. Anyone who is not a member of your household is a bat. He's unclean. It could be your mom. It could be even we ourselves who are trained, we can't tell it. So it is important and then to maintain that social distancing, and you must, anyone outside your household, please, especially this time when we're at the peak of this, let us keep that distance. So let's move to the next slide. This slide is such important. I will ask for your undivided attention. So you had that incubation period. Now the virus has cranked to million and your body has discovered we are invaded. Time to stage attack. Your body now has become a battleground between the virus and your immune system. This, what I'm going to say here, will save lives. In the time of pandemic, please do not auto-diagnose yourself. We discover now the most common symptoms, the most initial beginning symptoms of COVID-19 are sore throat, congested face and sinus and headache, your typical seasonal allergies, your headache. Another very important, unusual sweat. Unusual sweat, make notes of that. You're like, suddenly the sheet is wet. I was talking to a patient last night. He said, I was so wet, I went into the shower, I took shower, I came out, I was still wet, sweating. Okay? Loss of energy, fatigue. Muscle aches usually develop around day 2, 3. Cough probably comes a little bit later. Fever, please, I want us to de-emphasize fever. In other words, scratch it out. I even don't want you to look for it because it is not that common. And people end up looking and waiting for fever because they don't have fever. They say, I don't have COVID. I want you to de-emphasize fever. Emphasize sore throat, sinus congestions, headache, fatigue. Those are actually the initial symptoms. Why is that important? Because you cannot afford to lose the first day of your symptom. You cannot afford to lose track of your first day of symptoms. Please, everyone, for yourself and loved one, everybody in your life, share this message in the sense, anyone who develop any of these symptoms, please mark it down on the calendar. If it turns out to be just the usual sinus, that's good. But if it is a COVID, soon you will see why that is important. And then the loss of taste and smell. I put these two in different color because if you, I forgot to put diarrhea here. If you are having diarrhea out of no place, if you're having an unusual sweat, if you're having an unusual sweat, you have COVID, you have COVID, you have COVID. If you lost your taste and smell, you have COVID, you have COVID, you have COVID. I talk to patients, they say, I thought it's my seasonal allergy, and then I lost my taste. They're waiting for fever. I say, when was the last time in your life you lost taste and smell? They say, never. I say, so why the bell did not ring? So but don't wait for loss of taste and smell because these occur usually at around day 4 or 5, even day 6. It is not in the beginning. So a patient who come and tell me, I lost taste and smell, that was my first day. I said, no, that is probably your 4th day of symptoms. So please do not fixate in any of these symptoms to say, I have COVID. Let us, the clinician, decide. As soon as you feel any of these things, please isolate yourself and seek medical help for testing. Another analogy I like to use is this. If you were to go to Mexico City, you heard somebody say a word in Spanish, why would you imagine it is a Japanese language? Why? Okay. We are in the midst of pandemics universally everywhere. Even in my African village have coronavirus. Everywhere, everybody on planet Earth is at risk. So when you hear coronavirus language, do not ascribe it to allergy or something else. That's the most important message I can send on this slide, please. By doing that, you end up going around infecting tons of people, okay? And you miss your first day of symptoms. That's why this is critical. This is one of the messages I really wanted to get out, okay? Now, once you have symptoms day one, mark it down. The reason is this. If you are the high risk group we just talked about, diabetic, etc., if you are going to do poorly, you're going to start to break down at day 7 of symptoms. Most people who end up in the hospital, they come to us at day 7, 8, 9, and 10. And 80% of the 200+ thousand fellow citizens we have lost, 80%, they are men and they're older than 60. If it is a man who has no wife or women in their life, they probably come here day 10. It's getting late. So most admissions occur, the body starts to break down at day 7, 8, 9, and 10. If you resist and you still sit on it without any treatment, like we used to send people home, just say, go home. Now, remember we saw that slide, the oxygen is coming down. Because you are hypoxic, your oxygen level is low, your brain starts to go down, your thinking is messed up. I have lost a cousin who is a veterinary doctor in New Jersey, died in the house without informing us or anybody. It is because your mental state is going down. As the oxygen is going down, you don't know to call. That's why that paradigm of sending people home and say, don't come until your oxygen drops too low, it's terrible method of practice. If this person is still sick and does not comes around day 10, most people who come here from day 10, ICU admission occur day 10, 11, 12 to 14. If we do nothing, the cause of COVID is people start dying from day 10 to 17. No one dies before day 10 of symptoms. This is why this slide is such critical. By phase 2, which is day 7, the thing that brings people in the hospital is the breathing problem. That's why we saw that oxygen dropping here. Now they cannot breathe. It is here around day 7, that's what is bringing people to the hospital. So when a person is complaining to me of chest pressure, chest pain, breathing problem, and oxygen dropping less than 95%, guess what? This person is at minimum day 7 of symptoms. Because that's the time when the lung become an issue. That is the lung phase. We call it the pulmonary phase. It is the early lung phase and the late lung phase. So when the president reported to the hospital and they say his oxygen dropped and he had 3 days of symptoms, that's not true. The oxygen started to drop by day 7. He missed the first day of symptoms. He probably did not communicate it. That's why it is critical. Really, the one message I really want you to leave here with is your first day of symptoms. Make marks of it. When you have a loved one who is battling COVID, you need to know what is their first day of symptoms. By day 5, 6, and 7, you must watch them like a hawk. That is actually, you need, those who are high risk, you need to video in, you need to do FaceTime, not over the phone. FaceTime, that way you can see their face, you can see how they're doing. The reason is this. For those who are going to have mild to moderate disease, by day 5, 6, and 7, I want you to imagine a cloud that is going to rain. That cloud, if it is not going to rain, by day 5, 6, and 7, it starts to clear. So some of these symptoms here start to kind of get better. These are people who are going to be okay. But when the cloud thickens and become even darker by day 5, 6, and 7, in other words, these symptoms, the muscle aches become extreme. Now there is a chest pain. Now the shortness of breath and the cough is just getting. Day 5, 6, and 7, instead of seeing clearing, these are the people. This is the clue. These are the people who are going to end up in the hospital, and they must seek help timely. Now, see here, if you come to me at day 9, well, you're almost a day away from ICU. If you come here day 10, now you're in danger zone. That's why, if it is up to me, those who can sense they're doing poorly here, particularly when the oxygen drops below 95% or 94%, everybody should show up by day 8. And when I start intervention here, I will be able to prevent you from getting into this black area. In fact, the protocol I use for my country of origin, and which now I'm using for outpatient is derived out of this. Now look at this. If I were to intervene here, I can prevent this tsunami from taking off. If I intervene here, I can, but if I start to intervene here, I'm trying to bend this thing down. It may be difficult. So really, the bulk of the message tonight is the timeline. This timeline, your first day 5, 6, and 7 is really to pay attention how the symptom is doing. If it's not going well, by day 7, you have to seek help. Don't wait too long. Don't be macho. That is not a good thing to do. And that really is the thing I want to drive. I think I beat that to death. Now, everybody who has COVID-19, in fact, don't wait for it. Everyone must have pulse oximeter at home, please. You can get this in Amazon. You can get it on Walmart. If you were to go to Walgreens, Walmart, probably you will not find it. I think it's all bought out, but please have one at home. No one who has COVID-19, battling COVID-19, must be at home without these things. This is telling you how much oxygenation is in your blood. This is your heart rate. The critical one is this. When this drop below 95, it is because the lung is now heavily involved. Below 94, I would like to bring these patients to the hospital. Below 90, below 80, you are heading the wrong direction. Okay, so anyone who is isolated must never be isolated without this pulse oximeter. This is one of the most critical messages for tonight. Now, once you are diagnosed, even when you have these symptoms here from day 1, I really recommend some of these supplements. Again, this is any of these things, seek advice from your medical doctor. This is more for educational, but it's important to consider this because we're all vitamin D deficient. When I was isolated, I took 50,000 international units for 4 days. And then I drop it to 5,000 daily. I still take 5,000 daily. When you get this from Walgreens, it's about 5,000 units. It's like 10 of these. I took 10 every day for 4 days. And then vitamin C is critical, also anti-inflammatory. In fact, in the hospital, I give IV 3,000 milligrams every 6 hours. Here, I'm recommending only 1,000. So it's an important, and time in vitamin B1, it's also very important. Your melatonin is not just for sleep. There is some evidence that says it is even toxic to the virus, anywhere from 3 milligrams to 6 milligrams. Zinc is critically important. Even before COVID, we know zinc is an antiviral. But zinc is positively charged. It has difficulty getting into the cell. Remember, this virus lives in the cell. So you need to get the zinc in there. That is the reason for the hydroxychloroquine. It helps the zinc to go in, but it has become a political regimen. I still use it on my patients, but if quercetin is derived from plant, onion, and other type of plants, you can get it on Amazon easily. And from health store, it also helps the zinc to go into the cell. So I will take these two together. The zinc is important, but it needs to get into the cell. So quercetin will help do that. Pepsid will protect your stomach because you're taking high dose aspirin, but also Pepcid is reported to be toxic to the virus. This is extremely important aspirin. We saw here, this inflammatory response here, it also damages your blood vessels. So it forms clots. There is blood clot formation. It is two things that cause people to die. We think the blood clot is a major aspect of it. So aspirin really is critical. If you don't have ulcer, gastritis that you cannot take this, or kidney problem, anyone who is infected right from the beginning should be on aspirin 325 at least to 500. I talked to a patient who was taking 1,000 3 times a day. I think that's a little bit too much. 325 to 500 is enough. If you do not have any issue, I would say take 500 milligram for 5 days and then drop it to 325 anywhere from 14 days to 30 days. And so I do not recommend ibuprofen, Motrin, etc. Why? Because they are in the same group as aspirin, but it doesn't protect you against blood clot. So why take something just for the sake of it? I would rather take the aspirin instead of the ibuprofen. And then for fever and body ache, you can take Tylenol 650. That's very safe to do. And then this is a prescription. It is a topical steroid. Inhale, that will help the lung from getting too much inflamed, but it requires prescription. This is the only steroid you can take from the beginning. The first 4 days of symptom, no steroid. The reason is this: the steroid will hamper your immune system from clearing this virus. So you want them to do it, but you don't want them to overreact. The topical steroid will do the job without much problem. We're about to finish. I know that has been a little bit long. I will now take you through some slides very quickly. This is a CT scan of a lung, a good lung. This person is laying down with legs towards you. This is the right lung and this is the left lung. This is the great vessels where the heart and all of that is. This is a normal lung. It should look beautiful black because of the air. The air on the X-ray looks black. And then these are the bronchioles and the blood vessels. They look like star and branches. That's a normal lung. Look at the COVID lung. Can you see how much that lung is damaged? Look at the normal lung and look at that. This is why this thing is not like the flu. I entered medical school 1990, that's about 30 years ago. I have never seen anything like this. I've never had to treat 10, 15 flu patients in the hospital having difficulty breathing. So, here, again, I will show you a normal CT scan. This is the right lung, this is the left lung. Again, you can see just like the other, it looks beautiful. This is the heart, the diaphragm. We're going towards the stomach. Now, this is the COVID lung. You see that? That's the COVID lung starting there. At least this person has some good area of lungs. Now the COVID is taking over. As we go down towards the diaphragm, you can see the COVID lung. You can see the COVID lung. This is the reason why people cannot breathe. This usually starts to develop by day 7. And you can see this is a real patient, okay? Fortunately, I was able to send him home within 5 days. In terms of treatment, this is more for medical people. Again, I say there is no steroid from day 1 to day 4. Day 5 to 6 and 7, this is one of the protocol I developed. It's called Zardex for outpatient. It is consisting of a blood thinner and a steroid. This is the same steroid that was given to the president. If we are going to use antiviral, whether it is remdesivir, convalescent plasma, zinc, hydroxychloroquine, whatever antiviral, really it should be used in the first week when the virus is huge. But once you enter the pulmonary phase, it's no longer the virus, because by day 7, the virus is almost cleared. And by day 9, the virus is almost out of your system. I mean, almost dead. This is the reason why the current recommendation is for those who have mild to moderate disease, by day 10, they can be cleared to return to work. And those who have severe disease, the virus could remain alive maybe up to 15 days. That's why for those who have severe disease, we clear them from being non-infectious by day 20 of symptoms, from day 1 of symptoms. Once you are in the hospital though, the center of the treatment cannot be remdesivir, it cannot be plasma, because there is no virus to block here anymore. We know this for those who have influenza A and B. If we're going to give you Tamiflu, we have to give it within 48 hours. So if we're going to give antiviral, we should give it early. This is one of the reasons, the major reason as far as I'm concerned, is why we're having so much death in the hospital. Because even when you come in the hospital, the doctor is still using remdesivir convalescent plasma. They are still running after the virus, the time when the virus is actually gone. It is no longer the virus. It is the inflammation and the clots that is killing people. Therefore, the cornerstone, the center of treatment from day 7 onward, especially when in your ICU, has to be dexamethasone with blood thinner. And the dexamethasone is not the 6 milligram they are giving. It has to be more intensive than that. It has to be something like 5 milligram every 6 hours, 6 milligram every 6 hours, in order to bend this thing down. But if you use it here early on, day 6 in particular, you can prevent this from taking on. Again, this is more for clinicians than anybody else. This is one of the main thing I presented earlier today. I hope the clinicians will kind of pick this up. I really think it will change significant amount of patients that end up on vent, that end up dying. And this is how we can achieve success, really. So we're about to finish the takeaway. COVID-19 is real. It is a serious disease of our generation. Let us not minimize it. The other reason for that is this. Even if you end up not dying, if you are not treated properly, we are afraid that this thing will remain as a scar. So I'm afraid a year from now, we may see a lot of people with scar lungs, or what we call fibrosis. So I have some nurses, some doctors saying, oh, I want to get this thing right away so that I can have immunity. I say, not so fast. Remember, this is a coronavirus. Coronaviruses do not invoke permanent immunity like measles. That's why every season we suffer from common cold. That is not necessarily the flu. 25% of that is due to coronavirus. At most, the immunity now seems to last only 4 months. It could be only 12 months. So because of that, you cannot afford risking this. You have to treat everybody like mosquito. You have to treat everybody like bats, except your immediate family members. Proper mask is very effective. I treat COVID on a daily basis. The last 10 days, I was treating up to 10, 12 COVID patients. I wear my PPE, I wear masks, etc. None of us got infected from patients who are spewing tons of COVID. Those who got infected, they infected each other in the break room, as I mentioned earlier. So masks are effective. Masks protect you, but also it protects other people. I have a blog on that again on drimuro.com about the mask. You can go there and read more. Public health measures are effective. I will advise you to listen to public health people, the doctors. Do not listen to politicians. I am a physician, well trained. If I were to get into a Boeing 7 something, and I tell you, your whole family come on board, I'm going to take off, will you jump into that airplane? You'll be crazy to do that. Just because the guy is educated? No, that is not my cup of tea. Similarly, there is a reason why this is a biological medical emergency. Let those who specialize in this deal with it. Let them be the one to pick your source of information very carefully. It is a difference between life and death. In my state, the people refuse to believe in masks. Although we are in an empty state, we are now basically leading the country. We are the second state. The first one is above us. It's also an anti-state. They don't believe in masks. They don't believe in the public health messages. So please, put your source of information, pick it very carefully. Another thing I say is this: if you get sick, it is not the person who can treat you. You probably should not take advice from that person. Even if they're doctors. I hear urologists talking about COVID-19. I hear obstetricians talking about COVID-19. Surgeons should not talk about COVID-19. It is like we're all drivers. If there is an 18-wheeler sitting out there, I am not the driver for that, okay? We are all MDs, but this is not the field for all MDs. It is internist, my specialty, infectious disease, and the lung specialty, okay? Because if you come to the hospital, we're the one treating you. So choose your source of information very carefully. Do not play doctors. Do not write away your symptoms. We talked about that. Know your first day of symptom. That's the most important thing perhaps to take away today. You must have pulse oximeter. This is also important. Every disease we tell you to drink a lot of water except for COVID. The reason is this. This is a terribly inflamed lung. It's like a sponge. If you drink excessive water, it's going to actually suck this up and fill it up. And now the more you cannot breathe. So I say no more than 1.5 liters, maximum 2 liters. I lost my slide here. So this is very important. And then the other is do not exercise. Take it easy, okay? Because your body cannot get enough oxygen, you risk actually collapsing and dying. That's what was happening to the military in my country. A lot of people just fall dead because of that. So do not do that. Know your vitamin D level. And again, do not take steroids less than 5 days. Thank you all very much. I think I'll stop there.
Well, thank you so much, Dr. Imuro. Some people have texted me questions, and we will take just a few more minutes. We don't want to take too long, maybe 15 minutes or so. If there are questions, you can text me the questions, or you can raise your hand. Is it possible that you stop sharing, Dr. Imuro?
Mm-hmm.
So that we can. All right. So the first question, Dr. Muro, is somebody who's in phase 1, according to one of the slides that you had, who's experiencing those first symptoms, the sore throat, the aches, diarrhea. What should people do at this if they've been exposed perhaps and now they are experiencing phase 1 of symptoms? Maybe they're still waiting for test results, but what should they do at that point? Should they call their doctor and tell them I'm having the first symptoms? I was exposed to COVID-19. I don't have the test results. I kind of think that many doctors are going to say, we're going to need to wait for your test results. But what should people do if they're in phase 1 and they're experiencing the symptoms of phase 1?
Very good. A very important question. Number 1, isolate yourself. Number 2, make sure you have the pulse oximeter and your thermometer. Number three, start taking those supplements. Those supplements don't wait. Start your aspirin, start your vitamin D. In Mexico, they have the ivermectin, which is antiviral. In other words, you have to have some antiviral on board because your body is high in virus. That will be the ivermectin, that will be the zinc, that will be the quercetin, that could be the hydroxychloroquine. Those given in the right window will reduce how much your body is with the virus, and your immune system will not panic too much. They are smart. If they don't see too much, they will not unload too much. So, and then your symptom can be less. So yes, that will be what to do while you schedule your test and all of that.
Great. Yeah, great. There's another question. What about, you have the first phase 1 of symptoms and you start taking all of these things. Are there possible side effects, or are we not worried about possible side effects at the point because of the great danger that COVID actually poses?
You mean the side effect to the supplement?
Yeah, from the supplements and from the antivirals.
Not really. For example, if you are put on hydroxychloroquine, it has become a political medication. It should not be. We have used this medication for ages. Actually, it is considered to be one of the essential medications of humanity by World Health. Okay? But we have never given it 600 milligram, 800 milligram before. In the research, in those who are already on the lung phase, or even second stage in ICU, they were giving 600 to 800 milligram a day. We have never done that before. There are certain things we are doing with this pandemic. We kind of lost our mind. We have always given 200 milligram once a day or twice a day maximum. So that is, we send people out. We don't even worry about your heart rhythms. In the higher dose, yes, it can, what we call prolonged QT. There is a lot of medications that does the same, okay? Like the antibiotics, levofloxacin, and all of those, they do that. So really, no major side effect. That's why they are over the counter majority of them, with the exception of the hydroxychloroquine. Correct.
Those
the benefit is greater.
And those antivirals, people need prescriptions for them?
The zinc you don't need. The quercetin you don't. For the ivermectin, yes. For the hydroxychloroquine, yes. And for the budesonide, which is the steroid inhale, yes.
Mm-hmm. All right, thank you. I got another question here. On the same topic of these supplements and antivirals, are they recommended while being pregnant? Of course, that's not my question, but that's a question that somebody in the audience have. What about pregnancy and taking these supplements and antivirals?
Most of the supplements, in terms of the vitamins and all of that, they seems to be okay. But again, in keeping with the principle I mentioned before, I am an internist. I am doctor for adult, not for pregnancies and pediatrics. So that kind of question, I will defer it. If it was me, I will go with my list and I'll ask my obstetrician to say, hey, is this safe for me to take with pregnancy? I will defer that to the obstetrician.
Thank you. You touched on this already, but more to the point, when to go to the hospital? At what point, after having tested positive, do you go to the doctor? Do you go to the hospital? At what point would it be important for people to say, if this happens, then I should go to the hospital?
Correct. So by day 4, 5, and 6, if you are not doing well, now you know you are probably going to end up in the hospital. If you have, one of the key things is you start to develop chest pain, you start to develop shortness of breath, and your pulse oximeter is dropping below 94, it's time to go. If you fall in my hand, I'll admit you. But they will send you home. It's likely. Even now with oxygen like 88, they send people home with oxygen. Sometimes they send without. Like if you are worried, you go back again. Okay, don't say they send me home. I had a patient who came and he was sent home, and at day 7, he did not come until day 15. He was almost in coma. Because he said, oh, I went and they sent me home. No, there is an English saying, the noisy wheel gets the attention. If they send you home, you go back, you go back, you go back, and then they, oh, he came too many times. I think we need to admit him.
Okay. Thank you. There's a lot of people talking about chlorine dioxide, and you've mentioned it here. What are your thoughts on using that during those phase 1 chlorine dioxide?
Yeah, I have heard about that regimen. Mostly some of the patients or colleagues I talked to in Mexico. Here, CDC has actually, I think, labeled it as toxic. I haven't really taken time to look into it deeply. If CDC say it is toxic, I will probably stay away from it.
All right, thank you. There was another question on the text. What was it? Well, I have another question here. Somebody's asking, what are the side effects of hydrochloroquine, and should be concerned if it's prescribed to us?
Correct. I kind of touched on that. The major issue on the news is what we call the QT prolongation. In other words, the heartbeat is supposed to beat here, instead of kind of extended a little bit long. Your heart can go into arrhythmia. In the normal authorized CDC approved dosage, which is 200 once a day or 200 twice a day, we have never seen those side effects. It is not a problem. The problem is the dosage that was being used in the beginning of this pandemic. Once the report came out of France that it is effective, we were using 600 once a day to 800 once a day, which is really a toxic dosage. In the normal dosage, if the doctor prescribes it 200 once a day or 200 twice a day, as far as I'm concerned, there should be no worries.
Thank you.
And let me point this out. That really is between you and your doctor. FDA, once the medication is approved, FDA does not regulate the practice of medicine. You and your doctor can use medication off-label. For example, you could use hydroxychloroquine for treating malaria if you think it works for malaria.
All right, thank you. This is a little bit of a long question, and it's in Spanish, but I'll try to translate it. So exactly 2 weeks ago, I was told I was positive with COVID. I isolated myself from day 1 since I felt the symptoms, and I even isolated more than it was required. Here's the question. What are the possibilities that I am still contagious for my family? And what possibility is there that I would be reinfected?
Do I answer in English or in Spanish?
In English is fine.
Okay. Well, that's an excellent question. If your symptoms do not require you to go to the hospital, most likely your symptom is mild to moderate. Remember that slide we have there? When your symptom is mild, by day 9, your body has already annihilated the virus. The virus is dead. All the trillions are being killed. So that's why by day 10, maximum day 14, you can be cleared. You're no longer infectious to your family, or you can even go back to work by day 10, day 14. But that I defer to the health Department of Health. But clinically, she's not infectious. This person is not infectious. Can you be reinfected? Well, so far, worldwide, there is about 23 people who have been reinfected. Most of those reinfections seem to occur after the 4th month. Again, this is in keeping with the previous knowledge we have about the coronavirus, that the immunity seems to wane off over time. This is another reason why I do not bet too much on vaccines. Even if we get vaccine, if it is waning off quickly, and then really we have to get used to the public health measures to keep ourselves safe.
Great, thank you. Thank you so much. So most people have our numbers and we've been getting all of these questions, but if you don't have our numbers or you'd like to ask, we have about 5 more minutes. If you'd like to just raise your question, I really appreciate people muting yourself because this does really help with the sound. But if anybody at this point wants to unmute yourself and ask a question, we have a couple more minutes.
Mr. Camacho, good evening.
Hello, go ahead.
Good evening, Dr. Imuro. And I just want to say thank you for taking the time for treating me. I was really bad, but thank God now the medications are finally kicking in and I'm doing a little bit better. My concern was, as you continue with the dizziness, the bad headache, and my question was, should I continue or maybe get extra dose of the antibiotics because the phlegm clears up for one day and the following day it turns green again? Second question, if the person is, what did she ask me? If she is allergic to the steroids, is there a substitute for steroids?
Excellent. Hi, Raquel. Nice seeing you.
Likewise, and thank you so much.
My pleasure. We've been talking on the phone. Very important question. So that's an important question. It's important for me to mention here. The cough of all viruses, and COVID in particular, it is a dry cough. So it is important to monitor your cough. The moment your cough becomes productive, and then now you should pay attention. The reason is, just imagine the lung is bruised, just like if your skin were bruised and kind of whippy and beefy. Now that skin has lost its integrity to protect you from bacteria in the environment. So the bacteria find it very easy to cause infection of that bruise. The lung with the COVID is just like that. It is bruised, beefy. The bacteria we breathe in the air tend to now add a bacterial pneumonia on top of the COVID pneumonia. How do you know that is happening? When the cough becomes productive? If it does, it has to be clear. If it is clear, don't worry too much about it. But if it becomes green, yellowish, or other colors, now you have bacterial imposed. That's why everybody who is in the second phase to third phase, I always put them on antibiotics. There are 2 bacteria we worry about. The Staphylococcus species, the same that is the MRSA group, the superbug, and the Streptococcus species. These are the 2 that complicate viral bronchitis, viral pneumonia. If despite of that, you're having fever, or the cough is not clearing, it's still kind of greenish, yellowish, and then that means probably the staph has become the superbug, which will not be covered well by the 2 antibiotics I put you on. So now we have to expand it to a bigger antibiotics. So that is the answer to that. And that's the other reason why everyone I treat, I keep in contact so that I can monitor those complications so that we can change treatment very quickly. In terms of the steroids, you know, it's amazing. When you have an anaphylactic reaction, steroid is where we go to. But then there are some people who suddenly have allergy to steroids. And then really there is no good options. We could change it to a different type of steroids. We could change it to the same, but IV, people seem to tolerate that better than the oral. At that point, probably the best management will be in ICU. But the steroid is really the cornerstone once you enter into that second phase to the third phase.
Another thing, doctor, this medication was given to me from Juan. Is a friend of mine brought it.
Correct. So that is the ivermectin I was talking about. That is important in the first week when you just get infected. As soon as you discover, oh, I'm exposed, that will be the medication to go to. or you have symptoms, the first day, that is a medication to go to. But in the second phase, as you can see, the virus is almost dead, so it is not meaningful anymore. If any, it may be lingering, but it's just the benefit not as much as in the beginning. You could take it, it doesn't have a major side effect. It's an anti-parasite. We use it normally for parasites, but it seems it works for COVID.
Okay, well, thank you so very much. And one last thing, before you leave, would you put the names of the medications
That's
on your
lovely.
screen before you leave? Yeah. And thank you very much.
Ms. Miguel,
God bless.
did you have a question, Ms. Miguel?
Hi. Yeah, I have a question. I work in the hospital with COVID patients and as in therapy. I was just wondering, one, the incentive barometer, is that still working really well? And if we were kind of talking about it amongst ourselves, we work with occupational therapy, physical therapy, if they, you know, they receive so much oxygen, like with a high flow, is it more important that they're, you know, the long expiration, you know, or the inspiration, try to focus on the expiration because they are receiving so much inside? And also, secondly, on a rehab type of mentality, is there anything that you think I can do for my patients to help them, I don't know, get stronger and better?
Hi, Emma. Nice seeing you. Well, that's a very important question and a very difficult one. In the beginning, we were struggling how to involve physical therapy, occupational therapy, all the different therapies, especially when they are hypoxic, they are not having enough oxygen. It's kind of tough, but at the same time, they decondition very quickly. So to me, once I gain control of the oxygenation, with the steroid, by the way, one can gain control very quickly. The problem is in most of the hospital, almost all the hospital, they're using 6 milligrams of dexamethasone once a day. I use 6 every 6 hours. So the gain of control is quicker. Once you gain some degree of control, I think some passive, active activity is important so that patient does not decline any further. The incentive spirometer, I actually just came across an article the last 24 hours. It was mind-boggling. There are people who are even on the vent, they quickly decline and they die, despite of them improving. And it seems the reason for that is there is mucus plugging. There is thick mucus plugging at different levels of the bronchi. So a center will do bronchoscopy. It will take them an hour or two just unplugging all those plugs, sucking them out. And guess what? The patient come out of the vent very quickly. I'm really hoping that will take effect, and a lot of people will look into that. But it's a tough question. I do not have a good answer. But I think the incentive spirometer has to be encouraged, definitely.
Yeah, okay. Thank you.
Brian, you have a question too. I've gotten a couple of questions here. You'll ask your question right after this, Brian. I see your hand. What about exercise, Dr. Imuro? Do things like running and cycling, does that help to build stronger lungs, and would that help protect from COVID?
Definitely, any physical fitness give you added advantage. That's why I think it's important to maintain things optimum. We don't know which of these specifically will keep you strong, but it is more an immune issue. It is more your immune system not panicking, your immune system firing appropriately. That is really come down to that. So I think, yes, keeping yourself fit, eating appropriately, good nutrition, I think it is important.
Thank you. Maybe we'll have time for
Arturo,
questions. Go ahead.
Yeah, not when you're infected though. When you're infected, take it easy.
Got it. Yeah. Brian, Brother Canales, did you have a question?
I do. So one of the questions, and maybe you did go over it and I missed it, but is there a part are infected with the COVID-19 that you become, I guess you would become where you can't spread it anymore, like say the antibiotics at that point, like with your, I guess with the flu in the sense, right? Once you do antibiotic treatment, you cannot spread it. Is there a time in that when you are infected?
Okay, very good. An important question. So the problem with this virus is, with the flu, as soon as you get it, probably within a day or two, your immune system starts to react. So you have symptoms. With the virus, it can be from anywhere 2 days all the way to 14 days. There were some report even up to 21 days. So during this time, the body is cranked and filled up with the virus, and your body is not aware that it got invaded. So during all that silent time, you could infect. And then once you have symptoms, your body is able to effectively defeat this virus by 4th day, 50% of that. By day 9, especially if you're mild to moderate, the virus is cleared. So it is probably until day 9 is when you cannot infect. Day 9 of symptoms from 1. But CDC has not declared such a thing. Consequently, we have to abide by the guideline, but it's important to somehow know that is the case.
Awesome. Thank you, Dr. Imuro. I really appreciate your time.
You're welcome.
Thank you. Thank you so much. We only have like 2 more questions. Somebody's asking about NAC. People are familiar with those initials?
Mm-hmm.
Okay.
Yes. So NAC, NAC is N-acetylcysteine. It is an antioxidant. It is mostly produced in the liver, very significant regimen for clearing oxidants, etc. In the beginning of the pandemic, I used it a lot. I haven't seen a lot of literature on it, but it doesn't hurt taking it. It doesn't have bad side effects. So my philosophy is this: in the presence of having nothing, anything that can help your body, as long as it doesn't hurt your body, it's okay to take. So the principle I go by is do no harm. That's what I swear by. But do no harm doesn't mean it doesn't mean do nothing. Okay. So if I'm going to intervene, my first question is this going to do harm? If it doesn't do harm, is there reported benefit? If there is reported benefit, I do not have anything better, guess what? I go by that.
Got it. That makes a lot of sense. So the same thing could be applied to all the other supplements, right? If they do no harm, we can take them. Somebody from Guasave was asking, what is your personal take on, schools in gathering? I don't know if you want to comment about that.
Reopen?
Yes. What is Juanita say?
So yeah, to reopen or to not to open, to remain closed.
All right, correct. So this is why I said, in every aspect of things, because we are dealing with biological pandemic and medical emergency, it's just like when we got attacked in 9/11. It was national security issue. As a physician, I have no voice. I should not be speaking. I should be completely silent. I should leave this to the generals, okay, and the national security people to deal with it. In this biological crisis, it really should be the medical people talking. It should be guided by the public health officials. The public health officials say we need the positivity rate to be 3% or less. In other words, if you send out 100 tests, you swap 100 people, only 2 should be positive or 3 should be positive. That in that environment, it is safe to open up. Like in my state, the positivity rate is like 24%. Some days it is 36%. So therefore, as far as I'm concerned, the school opening is political. It is not medical.
All right. Well, thank you so very much. Oh, there's another question. Um, at what point of the oxygen saturation do people go to the hospital? You said 94, I think you mentioned.
My recommendation is 94 less. However, I understand in El Paso and a lot of places, even at 90, they will send you home.
Mm.
Definitely not below 90. If you are sitting in 88, that's not good. You definitely, either you have oxygen at home and being treated, okay, but you just sitting at home without any treatment below 94 is a no-no.
All right, last question, I promise. This is a cool question. Is it a good idea to take any supplements prophylactically or only upon diagnosis? I think you touched on this. If it does no harm, then if it helps you, then it's a good thing, it's okay.
Correct. The one supplement definitely I myself take is vitamin D. Just make sure your vitamin D, if you can do labs and know where your level is, that will really be the best. I check mine frequently. The last time I checked, it was 68. Normal level is 30 to 100 or 80, depending on the lab. My recommendation is maintain it between 40 to 60. Especially that we're entering into the winter, depending on where you are in the country, really everybody should be supplementing because we don't have time to get exposed to the sun or the sun is not there.
Got it.
And from time to time, when I feel like I'm exposed, I take zinc. I take zinc with quercetin from time to time, and not all the time. Also, they see periodically. In other words, when you feel you are exposed, or you feel you're coming with something you're not sure, definitely take your zinc, take your quercetin, take your other supplements.
All right. Well, thank you so much. We already kept you an hour and 40 minutes, so you're gonna charge us. We want you to charge us over.
It is the current. It is the currency of love and brotherhood.
Yes, thank you. Well, we have a lot of that for you, let me tell you. Well, thank you again so very much. I think this has been very informative. This person, I work in a hospital, I work with doctors, I talk with them, I ask them questions. And of course, you are there in the front lines and you're practicing, you developed a protocol and you've seen a lot of patients. So thank you for sharing your knowledge and sharing your wisdom with us. To everyone that came, I hope you took something away. We are recording. I'm going to stop the recording right now, and I can send the recording to